She was 42 years old and she was always late for every appointment. Every time there was an excuse, the traffic, I forgot, I lost track of time. Most recently, after she had promised vociferously that she was going to be at her appointment on time, she literally did not show up. I called her 10 minutes later and she apologized and apologized. She said, I met a really new person, a good friend, and we went out for coffee, and Dr. Gooderson, I can't believe it. I knew I had to be there on time, but I just couldn't. It went out of my mind, and I just totally forget. This is a prime example of what we call ADHD. And I must say that virtually, I'd say 50% of my new patients who arrive in my office, they are there because of ADHD. A tremendous amount of inattentiveness, attention deficit. They know they have to be somewhere. They know they have to be responsible, but they just can't get it together. There's something going wrong, something interferes. Whatever we who are punctual, whatever we think about, we're always attentive to time, goes totally out of the brain of people with ADHD. So to try to do something about this, I like to turn to what I call the Eisenhower matrix, created by President Dwight Eisenhower and then also used by Stephen Covey in his famous book, The 7 Habits of Highly Effective People. This matrix divides time into 2 sections. One is those things which are urgent, those things which need immediate attention, pressing things, and those things which are important, sort of long-term values and goals. So these categories, urgent and important, according to the matrix, they are divided up into 4 quadrants. Quadrant number 1, those things which are urgent and they are important. We call it the firefighting zone. In other words, do it now. You have, for example, somebody with chest pain, need to rush them to the hospital. Somebody with tax forms and it's the final day, you have a deadline, so you need to take care of it right away. Let's say the server on your computer crashed and it affects the entire business, urgent. A child gets hurt and requires first aid right away. Again, these things are urgent and they're important. Firefighting zone, do it now. Quadrant number 2 are those things which are important, but not urgent. These are building certain values and growth, scheduling times to do basic things that are so important for everyday life and for long-term success. It's actually where the wisest of people really live. For example, exercise, taking time for spirituality, working on building relationships, perhaps learning new skills, taking that important time for reflection. All these things which develop a person and help them in the long run. Important, but not necessarily urgent. And when the urgencies do come up in this category, you're able to deal with them right away because you build a foundation of working on your own growth and being connected to your values. Quadrant number 3, unfortunately, that's where many people with ADHD, they wind up living. That's when things feel urgent, but they really aren't that important. You get involved in these sort of minor things which really don't achieve anything for long-term goals. For example, we can get inundated with all sorts of emails and phone calls, which really may not be all that important. Get involved in minor things. Our coworkers may have all sorts of questions about things which really don't need to be taken care of right away. Maybe there's a meeting that you really don't have to attend. Category, you feel urgent. It's inside of you, but it really is not all that important. You need to learn to delegate and also to set some firm boundaries. Then there's quadrant number 4, which of course is things that are not urgent and not important. Sadly, people with ADHD, they spend time in this quadrant as well, as do many people without ADHD, wasting time. Of course, we do need those times for relaxation and reflection and rest. That's to give us the energy so that we can use our time wisely. Unfortunately, people spend way too much time in this world of not urgent, not important. Endlessly scrolling many hours per day, binge watching things which are really not that important, spending time gossiping or rearranging their files again and again when they could be doing more meaningful work. Yep, we need to eliminate it or we need to reduce it drastically. So of course, all this reminds me of a song. I'm sitting on the dock of the bay, wasting time. Time, because of course time is our key, our main priority in life. Ask somebody as they get older and older. People with ADHD and even people without ADHD, they wind up losing a sense of priority. And especially those with ADHD, they wind up becoming blind to time, getting distracted, losing focus. And as a result, it affects their work, it affects their relationships. So what to do? One of the treatments, of course, is medication. Medication can be very, very powerful. I've seen it work wonderfully for so many people. We need, of course, to be careful with any psychiatric medication. And most of these stimulant medications can result in a loss of appetite, which some people welcome. But if it becomes too much and people lose way too much weight, of course, that can be very dangerous. So you need to speak with your psychiatrist and get good treatment. When all is said and done, and you'll see a diagram here, you really want to be in the second quadrant, the quadrant of those things which are important but not urgent. That's where you grow. That's where you build your values. That's where you be in sync with who you really are. Life becomes a series of urgencies, running and putting out fires here and there. Well, yeah, you're taking care of those in the immediate, but you never really build a sense of foundation for your life. So quadrant 2 is where you want to be. How do you help somebody get into quadrant number 2? So there's a few strategies that I've read about. One is to color code. Yes, color code these 4 quadrants. Quadrant number 1, you can make it where it's urgent and important. Make it red, putting out a fire. Quadrant number 2, the one you want to be in, important but not urgent, that you color green. Things that you need to do, take action in, the green light. Number 3, where it's urgent but not important, make that yellow. You need to hesitate, you need to delegate. And number 4, where it's neither urgent nor important, make it gray, that you really don't want to be so engaged in this. Reduce your time there considerably. Another strategy is to take those activities in quadrant number 2 and put them into your calendar, and then have an alarm go off so that you can spend short periods of time involved in number 2, and make sure that you don't ignore that. A constant reminder. Not long periods of time, but short periods of time. Otherwise, you may get discouraged. Number 3 strategy is to have a coach or a therapist or a friend to help you. Talk with them about it. Make yourself vulnerable. Share your difficulties and how you can be focused more on quadrant number 2. And another strategy is what we call dopamine management, because we know that we get a surge of dopamine, that wonderful neurotransmitter, when we really get into something. In time, let's say 15 to 20 minutes in quadrant number 2, and then allow yourself to spend 5 minutes in quadrant number 4. Put a timer there so it ends, and then you return back to the important quadrant number 2. When all is said and done, when you look at quadrant number 2, well, it's really connected to who we really are. It's our soul. When we have our values straight, and then we live our values every single day. And the more and more you live with your values and practice them and put them into action, the more it will affect your neurons, what we call neuroplasticity. It'll become part of you, part of your every single day life. Sitting on the dock of the bay, wasting time.